Welcome to my channel, Nurse Katherine here. This is your 10-minute review for NCLEX for the day. If you like this video or want more of an NCLEX review, make sure to check the link in the description below. That will lead you to my NCLEX Mastery. Some of the questions today are based off of some of the questions on that app. You can receive 10% off your subscription with the link below, so make sure to go check it out. But other than that, let's get into today's 10-minute NCLEX review. You are performing an assessment on a patient with COPD. You recognize that which of the following are signs and symptoms of COPD. Select all that apply. A. Hyperpyrexia. B. Prolonged respiratory phase. C. Barrel-chestedness. D. Clubbed fingers. Here's our rationale. Hyperpyrexia is a fever, which is not a sign and symptom of COPD. B is true due to the increase in elasticity and decreased recoil in the lungs. C is also true due to air trapping. D is also correct. This can happen in fingers or toes. Chronic hypoxemia is thought to cause this, but the exact reason of this happening is still unknown. You are educating your patient on their diet during discharge instructions. Which of the following foods could you expect to tell your patient to avoid who was admitted with a gout flare-up? A. Spinach. B. Scallops. C. Yogurt. D. Tuna. E. Rice. Patients with gout need to avoid high purine foods. Spinach, scallops, and tuna are all high in purines. Yogurt and rice are low in purines. Purine forms uric acid on oxidation. Patients with gout flare-ups may have high levels of uric acid in the blood that can lead to crystals being formed within the joints. Your patient has been diagnosed with metastatic breast cancer. She is undergoing radiation and chemotherapy. Which of the following statements made by your patient exhibits a positive coping mechanism? A. I have looked into wig shops. I have found some really nice ones. B. I heard not everyone loses their hair. I'll make sure I won't lose mine. C. I'm not sure if I can go out in public if I have no hair. D. Losing my hair won't bother me at all. A is the answer. The patient is expressing positive feelings with positive interventions, which demonstrates a positive coping mechanism. B is wrong, as your patient is in denial, which is not a healthy coping mechanism. C exhibits avoidance, and this is not healthy. Lastly, D is incorrect, as the patient cannot determine how they will feel if they lose their hair. This exhibits denial. You are the nurse working on a postpartum unit. You are assessing a newborn that is 5 hours old. Which of the following is indicative of a babinski reflex? A. Hands and arms opening widely upon being startled. B. Turning of the head upon noise made. C. Plantar flexion of the toes when the foot is scratched. D. Dorsiflexion of the toes when the foot is scratched. The answer is D. Dorsiflexion is the movement a baby should make upon the babinski reflex. Plantar flexion is the opposite of dorsiflexion. It is breakfast time on the nursing unit. You have a patient who needs insulin with their breakfast. Their blood glucose is 220. They will need 10 units total of regular insulin. You administer the insulin at 7:30. You understand that the peak time of the patient's insulin is at A. 10 o'clock, B. 8 o'clock, C. 12 o'clock, or D. 7:45. The peak time of regular insulin is 2 to 4 hours after administration. Answer A is the only time that falls within that window. Which diet modification should you educate your patient on now that they have been prescribed prednisone long term? Select all that apply. A. Increasing calcium-rich foods. B, increase in bread and starches, C, increase in lean protein, or D, increase in sodium-containing foods. Prednisone has been associated with osteoporosis and weight gain. Calcium-containing foods may help offset this effect. Foods high in lean protein can help offset weight gain by reducing dyslipidemia. Which task can you delegate to the UAP, unlicensed assistive personnel? Ask the UAP to obtain an oxygen level of a patient complaining of chest pain and shortness of breath. B, ask the UAP to pause the IV pump since you are in another room. C, ask the UAP to provide a sling to the patient who fractured their clavicle. D, ask the UAP to obtain a stat blood draw on a patient who just came into the ER for possible sepsis. A UAP can do none of the following except answer C. A UAP can provide a sling but not educate on it. The RN has to be the one to educate the patient on the use of the sling. You understand that the proper way to administer an IM injection of 4 milliliters is in which of the following locations? A, ventrogluteal, B, deltoid, C, 1 inch around the belly button, D, in the love handle area. The correct answer is A. A and B are the only two actual IM injection sites in this set of answers. Injections in the deltoid have to be under 2 milliliters, thus making this option incorrect and leaving you with answer A. Your patient has just been diagnosed with an MI, myocardial infarction. Which lab result supports the MD's diagnosis of an MI for your patient? A, CK level of 0%, B, PT of 10 seconds, C, myoglobin level of 50, D, troponin level of 1. The correct answer is D. This is an elevated troponin level. If the patient's CK level was greater than 0%, this also would be supportive. Myoglobin and PT levels are not related with MI events or cardiac markers. You are working with a gentleman who is 59 years of age. He's explaining his family dynamics to you. Which of Eriksons stages of psychosocial development help you to understand what this patient is going through? A, intimacy versus isolation. B, initiative versus guilt. C, ego integrity versus despair. D, generativity versus stagnation. The answer is D. Answer D is the stage of psychosocial development for your patient's age group. I hope you all enjoyed today's video. That is it for this 10-minute NCLEX review for today. If you like this video, please give it a big thumbs up and make sure to subscribe to my channel as well. If you want more of these videos, comment below. If you want ones that are more specific to a general area, make sure you comment that below as well. Other than that, I'll see you in the next video, everyone. See ya.